Many of us have already experienced changes at our doctor's offices. Seems like technology and the future have arrived. Some of the changes we're seeing today are in part the result of President Obama's health care reform plan. On February 17, 2009, President Obama signed the American Recovery and Reinvestment Act of 2009, commonly known as the stimulus package. $19.2 billion were allocated to enhance the use of EMR for providers and hospitals. This part of the bill is called Health Information Technology for Economic and Clinical Health Act, or H.I.M.T Act.
So basically, we all know how computers and technology have changed almost everything we do, from banking to communicating. But most people don't know that the same applies for the medical field. The buzz started around 2000 with President Bush, and it was followed by an act being put into place by President Obama in 2009 called the American Recovery and Reinvestment Act, also known as the Stimulus Act. This act, amongst other things, provides financial incentives for those medical facilities that transform from being paper-based to entirely electronic by the year 2014. This will not only change the way medical records are stored, created, and retrieved, but it will eventually improve the quality of care for all patients. But in order for this change to be successful, we need trained and skilled individuals. Here at CBT, we are excited to be a part of transforming today's students into tomorrow's professionals with a bright and challenging future in the world of health information management.
Since we started this process, we were able to complete all the regulations, all the governmental requirements, allowing us to meet our meaningful use, which is all the government requirements in order for us to get our reimbursement from the government. And what they've allotted for is a $44,000 reimbursement for any physician that has met all their requirements with the use of the electronic medical record keeping. As a result, this obviously helps improve the quality of care to the patient. We're giving them what they need, exactly how they need it, and avoiding a lot of unnecessary medication that they may not need, or duplicating medication that they may already be on.
A recent New York Times article said demand for health informatics specialists with expertise in medical records, insurance claim, clinical care, and computer programming is rapidly increasing. In the article, Don Detmer, President and CEO of the American Medical Informatics Association, said, "My rough estimate is that we need about 70,000 health informaticians to meet EHR goals laid out in the stimulus bill." And that's just the surface. Ultimately, while many rail against bailouts for bankers and automakers, here's a part of the stimulus package that is performing the way it was meant to, by stimulating business, producing new innovations, and at the same time, improving healthcare for all Americans. The money allocated for EHRs and healthcare IT seems to be the least mentioned part of President Obama's stimulus package in the mainstream media. But the H.I.M.T Act will be creating jobs in hospitals, doctors' offices, and healthcare facilities in neighborhoods across the nation. In the meantime, we're seeing growth opportunities for IT professionals, software engineers, and third-party application service providers who provide EMRs and other healthcare IT solutions via the web. Also, there's a growth in career training enrollment for this field from colleges and universities to supply the needed workforce for this growing industry.
There are over 100 roles an H.I.M. professional can have in this field. It's so diversified. You can become a privacy officer, you can become a coder, you can become a biller, you can go into legal aspects, you can work for a legal firm, you could work in compliance for an insurance company. So many things that you can do with this different program.
Many of our local colleges and universities are addressing that new education need by providing degree programs to offer the expertise needed to comply with the new healthcare reform laws and regulations. One of these is CBT College in Miami, Florida, with a Health Information Management Technology program designed to train those that want to get into the field or those that need retraining. An entire industry in the process of change has opened the door of opportunity. Getting ready today to embrace it sounds like a very good idea. For CBT News, I'm Roberto Escobar.